Welcome to this video on the modern community pharmacy. We are exploring the essential transition from traditional, transactional dispensing toward a sustainable model as a true clinical health destination. We face a global pharmacy paradox. Traditional, volume-based dispensing models are struggling against rising demand, workforce shortages, and stagnant funding. It is time to rethink the pharmacy's role as a vital hub for local communities. To pivot strategically, focus on your sphere of control. While government policy and funding are often out of your hands, you have direct influence over team culture, workflow design, technology integration, and the patient experience. Execute on these areas to build a sustainable business. This paradigm shift requires moving from a legacy, transactional model toward a modern, interventional one. This involves diversifying funding, proactively interacting with patients, and fostering a collaborative, skilled team within a curated clinical environment. The FIP Modern Community Pharmacy Framework provides a scalable toolkit. It centers on patient outcomes and financial sustainability, supported by 4 pillars: leadership, clinical services, integrated technology, and infrastructure. Pillar 1 focuses on team and leadership. The goal is to move away from the pharmacist as a bottleneck. By adopting distributed leadership and empowering pharmacy technicians, you can build a more efficient and engaged team. Pillar 2 is about evolving your service portfolio. While dispensing drives initial footfall, private, high-quality services are what ensure long-term financial sustainability. Use funded services as a funnel to offer comprehensive, patient-centered care. The Making Every Contact Count philosophy transforms routine interactions into clinical interventions. By using open discovery questions to uncover real patient needs, you can provide tailored solutions that increase loyalty and business outcomes. Pillar 3 emphasizes integrated technology. The right tools, from diagnostic equipment to management software, should simplify your operations, minimize errors, and free up your staff to focus on direct patient interaction. Pillar 4 involves your premises. Your space should project clinical authority, not just retail. Curate your inventory, focus on your Health Hub brand, and design the interior to support a multidisciplinary approach to care. Remember, you do not need massive investment to start. High-impact transformation often begins with simple, zero-cost behavioral shifts and workflow redesigns that empower your team and improve the patient experience. This implementation roadmap starts with internal preparation, setting your culture, defining your vision, optimizing skill sets, and integrating necessary technologies to support your specific patient base. External execution follows by collaborating with local healthcare providers, enhancing your premises to match your clinical goals, and deploying an effective digital marketing plan to reach your community. Finally, adopt the fail-fast mindset within a sustainable innovation loop. Continuously refine your services and workflows to ensure your pharmacy remains both profitable and a valuable healthcare asset. To conclude, the global pharmacy sector faces significant pressure. However, by addressing profitability, workforce attrition, and changing patient expectations, you can successfully navigate this landscape and thrive. Let's revisit the core concept of financial sustainability. It requires focusing exclusively on variables within your inner circle of control. Avoid wasting energy on external factors that you cannot change. The FIP ecosystem for modern practice creates a cycle of improvement. By focusing on empowered teams, clinical services, integrated technology, and your premises, you build a resilient, high-value pharmacy business. Pillar 1 reminds us that you cannot manage change. You can only enable it. Avoid the, quote, control freak bottleneck. Instead, co-develop your vision with the team and delegate tasks based on hidden capabilities. Pillar 2 establishes clinical governance as the bedrock of premium service. Governance ensures safety and builds the patient trust required to move from simple transactions to impactful clinical interventions. To achieve a successful revenue pivot, you must escape the volume trap. Transition away from relying solely on government-funded dispensing and move toward private, patient-funded services that give you full control. Next, let's look at the implementation steps. Your journey begins with assessing your current operational strengths and identifying the key areas where you can start making immediate, positive changes. Engage your team early in this process. When staff members participate in the design of new clinical workflows, they are more likely to support the changes and deliver better patient outcomes. Start small. You don't need to overhaul everything at once. Choose one area of the pharmacy, such as a specific clinical service or a technology integration, and pilot it before scaling. Monitoring progress is essential. Establish key performance indicators to track the success of your new services, allowing you to make data-driven decisions that further improve your business performance. Cultivate your professional network. Connecting with other forward-thinking pharmacists can provide invaluable insights and support as you navigate the complexities of transforming your practice. By committing to these pillars and adopting a mindset of continuous improvement, you will position your pharmacy to thrive as an essential clinical destination within your local community.